Recently, issues of elder abuse have resurfaced in both home and institutional settings. As Stephanie Letterman, Executive Director of the American Federation for Aging Research notes, quotes, "A large segment of our population is both dependent and frail. Studies on elder abuse now alert us that seniors are also vulnerable and in need of help," close quotes. Well, how large is this at-risk segment? One study of 2,812 adults over age 65 revealed that 6%, or 176 of them, were seen in elderly protective services over a 9-year period. Nearly 3/4 of these cases involved self-neglect, but the remaining 27% were traced to the actions of others. Nearly 6% of the elderly people experienced physical abuse, 17% had been neglected, and almost 5% suffered exploitation. What is elder abuse? The U.S. National Academy of Science defines the problem as, quotes, "intentional actions that cause harm or create a serious risk of harm to a vulnerable elder or by a caregiver or other person who stands in a trust relationship to the elder, or failure by a caregiver to satisfy the elder's basic needs or to protect the elder from harm." Now, elder abuse not only implies that a person has suffered injury or neglect, but also that a specific individual entrusted to provide care is responsible. The abuse may take a variety of forms, including physical abuse, psychological abuse, sexual assault, exploitation of material resources, or neglect. Studying elder abuse is easier said than done. For example, a simple geriatric study on how to prevent elder fractures due to falls must consider confounding issues, such as polypharmacy, visual impairment from cataracts, and other conditions, and depression or dementia, to name a few. When one then attempts to decipher naturally occurring injuries from deliberate ones, study design and verification become critical. Was an injury due to loss of balance or assault? Did weight loss occur due to chronic disease and cancer, or from neglect? Was under or over medication the result of forgetfulness or malevolence of the caregiver? Risk factors associated with elder abuse are increasingly clear. Most incidences occur in shared living situations where there's prolonged access by a family member, friend, or an entrusted surrogate. Elder dementia creates both a complex management challenge and an unreliable witness to the abuse, which complicates documentation. Social isolation creates stress. That can lead to reactive abuse behavior as well as a hidden environment to harbor abuse, neglect, or exploitation. The presence of a caregiver mental illness, including depression or substance abuse, increases the likelihood of harmful behaviors, as does the use of a family member caregiver who's dependent upon and often resentful of the senior for whom they've been charged to provide care. Caring for a frail, dependent, and vulnerable senior is challenging under the best circumstances. Screening elders for abuse requires high awareness and good clinical judgment. There's not a clear consensus on routine monitoring or an instrument to be used. General concern should be raised when physicians, nurses, or other members of the care team observe a poor social network, poor social functioning, and signs of conflict between the patient and the caregiver. Trust your instincts, experts say. Thorough evaluation with a focus on cognitive function. Question the patient in private, and be cautious in discussions with the caregiver, extending empathy while uncovering the caregiver's training and their coping skills. Questions for the family? Is mom or dad declining without an obvious reason? What's the level of cleanliness of the patient in the home setting? What is the patient being fed? And under direct viewing, how gentle and effective is this process? Are there unexplained bruises, blisters, or painful areas? Is the senior's mobility rapidly declining? What's being said to the senior? Not simply the words, but also the messages and the tone. And what do your instincts tell you when you make unannounced visits? Would video monitoring be helpful? Addressing senior abuse requires a continuum of committed individuals from home to care sites and back to home again. providing reliable monitoring, oversight, diagnosis, and intervention when necessary. Such a network must be built, and a good place to begin is with an informed discussion of the issue between family members and their care teams. For Health Commentary, I'm Mike McGee.